Preston and Mary, when you reach a sky-high number of deadly overdoses, well, any downturn is going to be welcome. Both Seattle and King County are seeing lower numbers, so we took a look at some of the programs that they have in place. Head down almost any street in downtown Seattle, and the grip of fentanyl seems to be showcased in full view.
Any hour of the day, you know, it's just swarms of zombie-like folks.
But there are also signs the deadly drug is starting to claim fewer lives.
I want to highlight for you the work to date.
Public health leaders pointed to a 15% drop in deadly overdoses in King County so far this year. Seattle is seeing an 18% drop.
We've had a lot of good success getting people access to life-saving medications.
Programs like Health 99 give overdose patients a better chance at survival because follow-up visits help steer them into treatment. Next year, a new opioid recovery center will open with more beds for people who want to get clean.
We know people are out there struggling. We know people need help, and we need to be able to continue to innovate.
But the downturn follows a year when King County saw more than 1,300 overdose deaths, mostly due to opioids. A 15% drop still means more than 700 overdose deaths so far this year. And city council members question some of the strategies being touted by public health, including harm reduction measures like providing smoking supplies.
What is the harm that's being reduced by helping people, making it more convenient to smoke fentanyl, crystal, etc.?
And how are you prepared to ensure that the public health priorities are aligned to the council's priorities?
Well, this is a good direction to be going in because in the past decade, deadly overdoses have more than quadrupled, and the real increase came about 4 years ago when fentanyl became more widely available. Reporting live, Joel Marino, KOMO News.
To share in the fight against the opioid crisis, public health leaders in King County say the number of deadly fentanyl overdoses is going down for the first time in years. I talked with Joel Marino about what's leading to this drop in drug overdoses.
Well, Joel, thanks so much for being with us here at ARC Seattle tonight. So how much of a drop are they actually seeing in the number of overdose deaths this year?
Well, it's really the first time that we've seen this happen in a number of years to see a downturn in overdose deaths. So in King County, so far this year, they're seeing a 15% decrease from the same time frame in 2023, essentially January to early August. In Seattle, it's slightly better than that. It's 18% downturn. And this follows years where it just kept climbing up and up.
Yeah, is this really a drop when we're seeing fentanyl and other opioids kill people in record numbers?
Yeah, well, when you put it in context, I mean, we saw opioid deaths and overdose deaths in general pretty much quadruple in the past decade. And it really started to ratchet up exponentially about 4 years ago, around the time of the pandemic. But that was also the time when fentanyl became widely available. And, you know, it used to be a few hundred overdose deaths every year for King County. And suddenly it went to 700 and then 1,000. And last year it was more than 1,300 people dead from overdoses, most of them opioids. So, yeah, a 15% drop when you're sky high like that. I mean, it's going in the right direction, but it tells you still a long ways to go.
Joel, I'm curious, do they have any idea what's behind this downturn? I mean, you go down to 3rd and Pike, downtown Seattle, that whole area down there, and it's just an absolute disaster. Pretty much at all hours of the night, you can see people doing drugs, high on fentanyl, what have you. But to hear the downturn, it is somewhat surprising. Do they know what's possibly behind that?
Well, agreed, because you wouldn't, there's no obvious evidence on the streets that, you know, anything is changing. And I asked that of one of the public health leaders that did the presentation today, and he said, you know, we really don't know. We think it's a variety of intervention measures that we're doing to make treatment more available. It's this distribution of Narcan or naloxone to actually prevent an overdose from actually killing someone. You know, these people are being revived. And then there's some unique pilot programs, like Seattle has this thing called Health 99, where after they revive the patient, they try to do follow-up visits with them in the subsequent days and say, hey, you know, you were on death's door. Maybe it's time to go get help. And they try to work with these people, and it doesn't always work. But so the public health director was saying that they're not positive what the trend is. They're encouraged by it, but they feel that it's a variety of these intervention measures that they've been rolling out and spending millions of dollars on to try and make a difference.
I mean, it does make sense. I went to just a local little fair. I mean, maybe it was a couple weekends ago, and there was a health organization, I think it may have been in Snohomish County, handing out free Narcan, the little sprays for the nose, and had a conversation with a gentleman working there about, you know, how do you know when to use it? And well, he said you use it when the person's not responsive, and if they are responsive, then maybe they're just drunk and passed out. So I found that to be interesting, but at the same time, that's the first conversation I've ever had with anybody when it comes to how to appropriately use naloxone or Narcan on someone. But I think what you're saying could be right, just based on the fact that in the years past, you know, people haven't had the information about Narcan. It hasn't been as readily available as it is now. So those intervention techniques and those methods could be really making a difference. I am curious, though, as to planning moving forward, because it seems like the fentanyl crisis is in full swing.
Yeah, there's a number of initiatives that some of them are funded already, and some of them they're seeking funding for. And we're talking, you know, millions of dollars to put towards this, but they are hoping to hire more workers in the human services and public health areas to, you know, provide treatment services. They are opening up more beds for people who are ready to enter treatment to get clean. There will be more beds available. As soon as I think the first quarter of next year, so, you know, January, February, there should be more beds available through one program. They are expanding a lot of the things that they're doing already as pilot programs. But we're talking about you know, a vast amount of money being poured into this problem, because they say that we've got to save these people in order to get them into treatment. You know, if they're going to die on us, well, it's just done. And so they're lobbying city leaders and county leaders to get the funding to expand a lot of these programs, and I think we're going to be seeing more of that in the years to come.
Okay, Joel, thanks for the update, and we appreciate it as this continues to develop. You know, keep us posted. I know there's a lot more to come on this, and a lot left to do in the fight against the fentanyl crisis and keeping people alive down there and really getting them help and cleaning up that downtown area. Joel, thanks so much for being with us here on ARC Seattle tonight. We appreciate it.
Thanks, Preston.